Hello, folks, and welcome to my YouTube channel. You found yourself here today at mywiseinsuranceguide.com. This is my YouTube channel for Insurance Wise USA. And what we're going to do today is we're going to do a little tutorial about Medicare 101 2025. I'm a little late about getting to this, so I got really busy there at the tail end of 2024. So we're just now getting this up on my channel and getting it posted. But let me tell you a little bit about what this presentation is about, a little bit about me. My name is James Laughlin. I am the president and founder of Insurance Wise USA here in Florida and expanding into other states, growing and loving everything that I do, helping people navigate this freak show that we call health insurance or Medicare. Uh, the presentation that you're going to look at is no different than the presentation that I would do if I was in your living room or if I sat down with you one-on-one. So as you're watching this video, before you get started, if you would, below this video, there should be a See More button. Or something to that effect, where you can click on it and all my contact information is going to be right there. So if you have any questions about this video, you can actually click on one of those links. It has my web page with my phone number, my email address, and I'll also have the links there to my YouTube channel and my Facebook channel if you want to do a friend request and have any questions or want to see the content that I put down there or post there. So with that being said, let's just take a look at the other windows that we have, and then we'll get started with the presentation. So this right here is my web page, which is going to be in the contact information below this video. But if you come here, you're going to get my number, you're going to get my email, and then you're also going to be able to book a 30-minute consultation with me if you want a phone consultation and go over your different options that you have. And as you can see, I do a multiple number of things in the insurance industry. Health insurance, which is going to include the Affordable Care Act, Obamacare. I have alternatives to Obamacare. All you got to do is click on this. There's a video in there that'll tell you about the alternative to Obamacare. You can get quotes for Obamacare here. If you're aging into Medicare or you're finishing your 24 months of disability, you can get a quote for Medicare right here. Dental and vision options, click here. You can get a quote for discount plans, whatever you might need. If you have challenges with any of this, just give me a call, reach out to me, and we'll get you taken care of. So I also do life insurance, gap insurance, which is considered like critical illness, heart attack, stroke, things to that nature, accidental insurance coverage. And then I do annuities. So anybody who's 65 aging into Medicare, normally or not normally, but sometimes you have a significant amount of money in a 401k. Okay. You want to move that money into something. So I recommend index annuities. Index annuities protect against loss. It's like putting your money in an elevator that has a button that only goes up one way up. You can't lose with a indexed annuity, and I'll explain that to you why sometimes it's a better option than going with a financial specialist who offers mutual funds who's going to talk against annuity. So with that being said, we're going to return back to our presentation, but know that I have a Facebook page here. You can do a friend request here. I'm going to put the links at the bottom of the video. And there's my YouTube channel that this video is going to go into, which is going to be sitting right here with Medicare. I have to redo this video because I was missing some pieces in it. But it's going to replace this one here. And then there's other information here, like looking up your prescription drugs. That's going to be valuable to you. So come back to this YouTube channel, hit subscribe on any of the videos, like and subscribe. And then when I add a new video, you're going to be updated. So with that being said, let's get back to the presentation. Okay. Medicare 2025, there's been a few changes this year. One of them that's big is the prescription drug benefit. The maximum out-of-pocket cost for prescription drugs used to be $5,900. It dropped to $2,000. Maximum total out-of-pocket cost. We're going to be talking about that in this video because it's impactive on a lot of the Advantage plans. But when you're coming into Medicare, the first thing that you need to know your first step, the first thing that you should do is you need to apply for a Medicare ID card. So you would not have to do that if you're already on Social Security. If you're already on Social Security, you're in the system, they're going to send that to you. It's going to be automatic. You're going to get your Medicare A and B, you're going to get a Medicare number, and you're going to have effective dates for Medicare A and B below that number. So on the other hand, if you are not on Social Security and you're aging into 65, let's say that you don't want to retire yet, you're still getting group insurance, maybe you want to retire at 67. You still want to call Social Security about 4 months out from your birthday. So that way you'll have that card when you're within 90 days of your birthday, we're hoping, okay? Because sometimes Social Security can be very slow. So anyway, the reason you want to do this is because if you're not on Social Security already, you want to be in the Medicare system. So even if you're on group insurance, because what you can do is you're going to get your Medicare Part A, which if you're paid into the tax system here in the United States, at least 10 quarters, you're going to have a zero premium, monthly premium for Part A. So that could be your secondary on top of your group health insurance coverage. Where when it comes into Medicare Part B, and we're going to explain all those Medicare A, B, C, and D. So, but Medicare Part B, there is a monthly premium for that costs $185 a month that you can actually defer until you actually retire and go on real Medicare. So with that being said, we're going to jump right into it and we're going to break all that down and we're going to make you all smarter about it. Keep in mind that because this is a YouTube video, if you have to walk away from this video, there should be somewhere that tells you exactly where this video is. Have a pad and paper, write that down. If you have to come back to it, write it down and just go right to that so you don't have to listen to the same stuff over and over again. One of the advantages that you have to watching these videos, not to mention, if anybody is sick, has got a cold, we're not going to catch that from each other with these YouTube videos. So anyway, so I like the fact that that we've modernized and the Zoom and all the video platforms have made it easier to get our message across, and we can sit in the comfort however we feel most comfortable. Okay, so moving on. Anyway, so all this information that I share with you here in this video can be looked up or found at cms.gov. So you can see right here, this is the link. All the information, any questions that you have about Medicare, it's either medicare.gov or cms.gov. It's going to bring you to this page. You can have any questions answered there. Sometimes it's kind of hard to navigate because you'll punch things in and it won't bring up the slides that you want. So hopefully this tutorial is going to help you because I've already done that for you and we break it down and we're going to go over the questions that you would have that are going to be pertinent to just about everybody's situation, okay? So this is your guide, medicare.gov, cms.gov. Any questions you have, you can go there or you can reach out to me. And again, my contact information below this video, when you hit see more, you're going to have my webpage, my YouTube channel, my Facebook, all kinds of ways to get a hold of me, and I hope you do. So anyway, so the next slide is Medicare.gov for prescription drugs. Okay, so if you have prescription drugs that you want to look up, this is where you're going to want to come and establish an account. I've done a tutorial on my YouTube channel, mywiseinsuranceguide.com. That link is going to be below this video as well, where you can go to that tutorial and it's going to teach you how to use this page if you're not familiar with it. It's a very short video and it takes into effect like things like metformin, just a couple prescription drugs that you can throw in there to give you an idea of how to navigate it and go through that. So if you have any questions, again, you can reach out to me. But the reason that I've moved to videos is because in 2025, the total maximum out of pocket cost used to be $5,900 for prescription drugs. Well, they lowered that to $2,000 in 2025. And because of that, what they've done is they've decided that they're not going to pay insurance agents pretty much any commissions on tier 1 or tier 2 type prescription drug plans that offer a zero premium because the agents aren't bringing the company any money, so they're not going to pay any commission to that. So the only plans that show up on our dashboard, us agents, are generally type 3 and type 4 prescription drug plans. So my way to get around that, being that I'm not getting paid to promote these guys' business anymore, is to create a video where you can actually go to Medicare.gov, look up your prescription drugs, and I have a video that shows you how to do that. So all you got to do again is my YouTube channel should be below. If you hit see more, take you to the YouTube channel, scroll down till you see Medicare prescription drugs, and I will walk you through it just like I'm walking you through this video. Okay. All right. So anyway, let's break down Medicare real quick. Let me adjust this window. Oh, bear with me. Not cooperating. There we go. All right, so there's 4 parts of Medicare. You guys are probably already aware of this. For those of you who are not, let's just do a real quick breakdown. The 2 major parts of Medicare are Medicare Part A and Medicare Part B. So I'm not going to bring out my pencil. Hopefully you guys can follow my cursor. But these are the Medicare Part A and Medicare Part B are what you're going to be issued when you either go on disability or you're aging into Medicare. So the best way to keep these in mind is Medicare Part A is going to pay for your hospitalization. So it's pretty much your room and board. So, and there's some deductibles and things like this that you can pay attention to. You probably wouldn't remember them, but keep this in mind. Ultimately, if you're in a Medicare supplement or you're in a Medicare Advantage plan, you're going to have a 0 monthly premium if you've been in this country long enough and paid enough quarters into the tax system. The monthly premium is 0. These are all co-pays, which are absorbed sometimes by the Advantage plan. And if you have the right Medicare supplement, you're not going to pay any of this. So that's Medicare Part A, room and board. Medicare Part B is your doctors and specialists. So that's your primary physicians or your knee surgeons or whatever. The way that works is Medicare pays 80%, right? And you pay 20%. So, and there is a annual deductible with this Part B of $257 a year, once a year. Okay, once you meet that, then you're not paying anything more for Medicare Part B. Okay, there is a monthly premium for Medicare Part B, and it doesn't matter whether you're in regular Medicare, Medicare supplement, or you're in a Medicare Advantage plan. So if you're in one or the other, you're still going to have to pay the monthly premium of $185. So that is either going to be paid directly by you if you're not already on Social Security and you want to take Medicare, you're going to pay them directly. Okay. If you're on Social Security, they will draw that out of your Social Security or a railroad fund, things of that nature. So if you just actually getting on Social Security and you're getting into Medicare, they'll take this right out of your Social Security and you won't even miss it. So, which makes it easier for some people to manage. Okay, so those are your 2 choices up front. You have Medicare A and B. Okay, you need to have Medicare A and B. You don't necessarily have Medicare Part B. Does not have to be into effect. You can defer that by calling into Medicare 4 months before your birth month. Let them know that, okay, I'm still working. I have group insurance. I don't plan on retiring until I'm, let's say, 67. So what you want to do there again is call into Medicare 4 months before your birth month. Let them know that you want to sign on to Medicare because you're not going to pay anything for Medicare Part A. Hopefully your monthly premium is going to be 0 because you paid into the tax system enough quarters. And they'll issue that Part A because the monthly premium is 0. So you have that, and they'll defer the Medicare Part B until you retire. So that way you're not penalized, all right, for Part B. And you defer that. So when you actually decide that you want to put Medicare Part B into effect once you retire, you get the benefit of a free look. That's your initial enrollment. They'll call it an SEP, which is a special election period. But it's your initial enrollment. So during your initial enrollment, that you don't have any underwriting. So they overlook underwriting. You don't have any underwriting during this time. So you're able to get into whatever plan that you need to get into. Okay. So your other choice is a Advantage plan. So Medicare Part C or Advantage plan. So what are Advantage plans? Advantage plans are when private insurance takes you over and provides your care. So ultimately, they cannot offer you anything less than what Medicare A and B offers you. Okay. They even at times have Medicare Advantage plan prescription drug plans where they'll have the prescription drug plan in with the Medicare A and B plan. So the way this works is the government actually subsidizes these insurance companies like AARP, Florida Blue, Aetna, Cigna, Humana, all of them. So anybody that they move over to an Advantage plan, the government subsidizes and sends them money. Okay. But now they are responsible for paying your hospital bills. Okay. Which is why when you walk into a doctor's office, sometimes you see that the doctor is not accepting Medicare from this particular company. And the reason for that is because they haven't paid their bill or they haven't been paying their bills. Because keep in mind, these are for profit companies. And these guys sometimes don't want to pay the bills in certain quarters because they want to remain in the black. So when that happens, doctors get upset and they say, we're not taking these people. Keep in mind that does not apply to Medicare supplements, guys. So Medicare supplements is being paid by the government. Okay. So they're getting at least 80% of that and they're getting some money. So they don't like to say no to those because they get money, they get paid. And generally, if you see a sign that says we're not taking this particular insurance company, they're only talking about the Advantage plans. Medicare supplements should be taken by any doctor that takes Medicare throughout the United States. All right. Uh, yeah, as long as that doctor takes Medicare, it doesn't matter what Medicare supplement you're on, they should be taking that. A lot of times, the people behind the desk don't understand the difference, so you might have to explain that to them. But that's what's being said there. So if you have any questions or pushback, again, you can call me. My number, right? Hit the see more below. And when you open up, just be sure to hit that subscribe and like the video. But with that being said, we covered part A, we covered part B, we've covered part C. We're going to dive deeper into that. And then you have Medicare Part D, which is prescription drugs. If you have a Medicare supplement plan, you have to add a Medicare Part D plan to that. You don't have to do that, but you want to do that because if you are on a supplement, you don't get in a prescription drug plan Part D, you're going to be penalized by the government 0.5% of what the national average, monthly national average is of a Medicare prescription drug plan every single month. Okay, so 0.5% of the national average every single month. When you finally decide that you want to get on a prescription drug plan Part D, they're going to take that penalty and add it to your premium that you have for the rest of your life. Okay, so the way a lot of prescription drug companies or private insurance companies have got around that is they now offer plans for people who are like on aspirin, Tylenol, don't really have any prescription drugs. They have zero premium prescription drug plans now inside Medicare.gov. So again, I have a tutorial on how to look up your drugs and enroll in one of those plans on my YouTube channel, mywiseinsuranceguy.com. Be sure to go watch that, like that video, and subscribe. But it teaches you how to look up your drugs, pick your pharmacies, look at the prescription drug plans from the cheapest to the most expensive. And many of those have zero premiums, which us as agents are no longer getting commissions for. Okay. They don't even show up on our dashboards, which is why I don't write them for folks anymore. So I just created this video to help you actually go in and sign up for a prescription drug plan on your own. But if you need help and you need assistance, you can always reach out to me. I am here to help. Okay. So moving on, the next slide that we have is 2025 Part A costs, all the changes that happened financially, all the costs that changed from 2024 to 2025. If you want to pause it here and look at this, you can. You can screenshot this particular slide by hitting Control Print Screen on your laptop and just save it to a WordPerfect document or any type of document that you have that you can save it to. So same thing with this slide. This is all the changes that came in to Medicare for 2025 Part B. You're going to be able to see where the costs have been adjusted. Now, typically, every single year, these costs rise. Not much. And in some years, like last year, we even saw a little bit of a reduction in some areas. That's not common. Typically, these numbers are always going to increase a little bit every single year. And this slide is going to tell you where those increases came from. Okay. This next slide, it actually breaks down the Part B monthly premium. If we go up to this slide here and we come back to Part B, remember there is an annual deductible for Part B. This is a one-time deductible every year. This will be more next year, but right now it's $257. And then you have a monthly premium of $185. So this monthly premium is determined by your income, what you file to the IRS. So this is going to be different based on what the IRS knows that you're making. And this is that chart. So you don't have to give this information out to an agent. I'm not going to ask you. I'm simply going to put this in front of you. You know what you make, what you filed, and this is what you're going to be charged for that monthly Part B, Medicare Part B premium. So keep in mind, again, you're paying this premium whether you have a Medicare supplement or whether you have a Medicare Advantage plan, okay? Either way. So the more you make, the more you're going to pay. All right. Okay, so this is the prescription drug flow chart. This is how this works. So this year we have a $590 annual deductible for prescription drugs. Okay, so last year we had a $5,900 maximum total out-of-pocket cost for prescription drugs. That has been significantly narrowed down this year in 2025 to $2,000. Okay. So, and we have benefits like you can get now your insulin supplies for $35 a month. And there's been some pretty drastic and strong changes when it comes to prescription drugs. So that is a benefit for you guys. And prescription drugs is a pain in the butt. I get it. So this has gotten a lot better for you. But what this has created in the insurance industry is with Advantage plans, we're going to see a lot of changes here in the future. Because again, as I mentioned, the private insurance companies that write these Advantage plans, they're all competing against each other because they're getting the same amount of money from the government to sell these plans. So what they try to do is with the money that they're subsidized, they like to throw other added benefits into their Advantage plans. Okay. So that's how they compete. But right now, this year, since there's been such a drastic reduction in the total out-of-pocket cost for prescription drugs, those insurance companies have to find out what they can cut and what they can't cut. So I would expect 2025 to be an experimental year for the insurance companies to find out if they're going to be able to be profitable or where profitable in these areas and what areas can they keep or what areas are they going to have to cut or increase copays and things of that nature. And that's the one thing about Advantage plans. Advantage plans change every single year based on what the government is giving them. So keep that in mind. Medicare supplements, they don't ever change. Medicare supplements are going to remain the same except for your premium. Your premium is going to adjust based on the cost of medicine. What I can do to help you with that is actually show you analytics of the companies who have the most consistent pricing over a 10-year period, who has the lowest price increases in the industry. And there's one that I actually like to refer to that actually is below the 2% price increase threshold. Everybody else in that audience is 3% or higher. So, and most agents who are not aware of this are not going to be able to share that with you. I will. This is how we're going to find the right insurance company and the right fit for you, unless you already know what you want. I'm a broker. I can write you United Healthcare, Humana, Aetna, Cigna, Florida Blue, just to name a few. Okay. Okay, let's talk about what's not covered by parts A and B. Okay, so this is a big deal because, again, Advantage plans over supplements. Get a lot of people saying they don't understand Advantage plans always look so good in the beginning. People are like, well, why wouldn't somebody get on an Advantage plan? It just seems too good to be true. Well, it's all a smoke and mirrors trick. Now, I'm not saying I don't like Advantage plans. I love Advantage plans. Advantage plans are great. And there's a lot of different options with that. But Medicare supplements are also great. And doctors love Medicare supplements because they always get paid. So, but let's talk about what's not covered with regular Medicare. So if you're on regular Medicare, meaning that you chose a supplement over an Advantage plan, which is a private insurance, then with that, you're not going to get long-term care. So you're not going to get long-term care with Advantage plans either. Keep that in mind. That's not something you're going to get. You're going to have to get that on the side. And you want to do that when you're healthy because long-term care is very difficult to get. And the older you get, the more the premium is going to cost. So Medicare does not cover long-term care and only covers a small amount of days for skilled nursing care. So you have to have a game plan for that or not. So just be aware of it. So the other thing that Medicare doesn't cover is dental. Okay, this is another reason why a lot of people do like Advantage plans because a lot of these Advantage plans will throw in the dental hearing benefit, but keep in mind this, they're different. Some are a lot more than others. So you want to know if you need dental work, that might be a good strategy for you, you know. So maybe you don't have a lot of money, you like the zero premium that Advantage plan brings to the table, and they offer dental and vision. Okay, so uh, every insurance company is different. They don't offer the same amount. You know, like I mentioned, they're competing with the same amount of money that's given to them by the government. So they'll like to make these adjustments to draw in more business. Okay. So dental and vision and dentures, cosmetic surgery, plastic surgery, all that stuff. Yeah, not covered by Medicare, not covered by Advantage plans either. Okay. Acupuncture, sometimes there's some Advantage plans that will cover acupuncture. Regular Medicare does not. So hearing aids, you will find that some Advantage plans will give you allowances for hearing aids. Routine foot care not covered by Medicare. And there are other things that Medicare Advantage plans are going to give you that regular Medicare will not. So again, keep in mind that the Advantage plans can't offer you anything less than what Medicare is offering you. They can only offer you the exact same thing Medicare offers you, and then they have some added on benefits that they throw in there from the money that's subsidized to them from the government so that they can actually lure you in and grow their business, their base. Okay, so keep that in mind as you're making your decision. Okay, so we talked about Advantage plans. So what I didn't talk about with the Advantage plans was the difference between HMOs and PPOs. So what we're going to do is we're going to move this right here. Okay, this screen right here. Let's see here. Where were we here? Okay, what's covered, what's not covered. Okay, so now we're going to talk about the advantages of Advantage plans to supplements and what's the different Advantage plans that they have. And then what we'll do is the next slide is Medicare supplements. Okay, so we're going to break this down because this gets confusing to people when you have Medicare A, B, C, and D, and then you have supplements, right, guys? And it's like, oh, they got all these supplements here. Well, there's really only a couple that you need to be concerned about. The rest, nobody really uses. The big ones in the industry are F, which is only available to people who turned 65 before 2020. So these two right here, if you're just turning 65 now, don't apply to you. If you turn 65 before 2020 and you want to move into a different supplement, you can still do that and use this guide. But the two plans that I like to offer for people who are aging in to Medicare at 65 are the G plan or the N plan. And then there's a high deductible F and G plan, which we're going to talk about. Okay, we're going to come back to this slide. But first, we're going to still talk about Advantage plans. Okay. And what are the advantages, disadvantages? So we know that you can either have a supplement, got to be on Medicare A and B. So you don't want to just be on Medicare and not have an Advantage plan or a supplement, because if you don't have one or the other, then you're going to have no limit on your total out-of-pocket costs. Your maximum total out-of-pocket costs is important because that means when you get to a certain level, they can't bill you anymore. So if you just stay on regular Medicare A, B, and D, and you don't get an Advantage plan or a supplement, and you're going to self-insure is what they call it, then you have no cap. And if you end up, getting in some major illness that keeps you in the hospital for a year, yeah, it's going to bankrupt you. So you want to make a decision and go into a supplement or advantage plan, whichever one works best for you. So here's the breakdown. So first off, if you decide to go an advantage plan, so those are the plans you see on TV all the time where they're going free this, free that, free rides, free meals, a flex card, you get this, you get that. You can even get a portion returned back to you from your Part B monthly premium that you have to pay. So those are all nice hooks. Those are great commercials to get your attention. And some insurance is better than no insurance. And if you have no money, if you're low income, Advantage Plan is where you need to be. Some people don't qualify for Medicaid and they're just past that threshold and they don't have enough money. They can't afford insurance. So there are great HMO plans that have low total maximum out-of-pocket costs and low co-pays. The trick to HMOs, though, is you have to go to their doctors, who they recommend. You got to go to a primary physician first, who's going to recommend you to a specialist or wherever you need to go. So, but you're going to have insurance and that monthly premium is going to be zero. And with those plans, you can get dental and vision and all these other added benefits. So that's great for somebody who doesn't have a lot of income. Now you have insurance. It's going to be a good deal for you. So an HMO is a good place to go. Just know that you're going to go to their network doctors. And sometimes these plans are so lean, meaning that they give you so much. Okay. So keep that in mind when you see this on TV and they're offering you the moon and all this free stuff, that they have to negotiate these with the doctors that accept them. And they become so lean that a lot of doctors are not going to accept them. And they can even decide that midway through the year that they're not going to accept these plans anymore. So be mindful of that when you're choosing your plans or you're looking for free stuff that they're advertising on TV to get you to change from whatever it is that you have. So if you have an agent or you're working with a broker and you have a relationship with them, I encourage you to call them. Okay. The other alternative to an HMO is a PPO. Okay, so that's why there's different scenarios for everybody. Say you're somebody, I'm here in Florida. I'm actually expanding into other states, but my residence is here in Florida. That's why we're Insurance Wise USA now. We don't just ride in Florida. But let's say you live in Wisconsin and half of the year, and you live in Florida half of the year, but you have your home residence here in Florida. So in that case, a Medicare supplement is probably your best way to go if you're dual state, because you have no network. If you have a supplement, anybody who takes Medicare in the United States is your network. You can go to any doctor, the price is the same, the copays are the same. You don't lose your agent. You don't have to switch insurance companies whatsoever. But if you don't or can't afford don't want the monthly premium that comes with a Medicare supplement, and you like the freebies that come with Advantage plans, like some dental benefits and vision benefits, then maybe the best plan for you is a PPO. So what a PPO allows you to do is skip the primary physician. You don't have to go see them. You go to any doctor that you like that takes Medicare and get service. So here's the catch. PPOs still have networks, so you can go to in and out of network doctors and still get coverage. But when you go to a network doctor, you want to find out who those networks are. You're going to pay what the plan says it's going to pay. You're going to pay a lot less, and your total maximum out-of-pocket costs are lower. So now with the PPO, because there's so much freedom in your choices of doctors, your copays are going to be more expensive than the HMOs. Okay. So, and your total maximum out-of-pocket cost is going to be more than the HMO. In addition, if you go out of network with a PPO, which you can go to any doctor that takes Medicare, your copays are likely going to double, and so is your maximum total out-of-pocket cost. Could range in the area of $11,000 is what I'm saying. Okay. So keep that in mind when you're making your choices, guys. So anyway, we talked about Advantage plans a little bit there. Let's come back to supplements and break it down. So let's say I want a supplement. And why do you want a supplement? Because here's the thing with supplements. You do have to pay a monthly premium for a Medicare supplement. and they don't offer dental and vision, and you don't get the free gym memberships or the free ride shares and things of that nature. So, but there are people who have been in the workforce who are used to paying $1,200 or $800 even for a health insurance policy that they had. And it was a good policy. And then they come into Medicare and they could get a policy that covers just about everything. So, like if you look over here at the F plan covered everything that Medicare doesn't cover. Now, let me make this point. When I say they pay everything Medicare doesn't, Medicare approved charges. If there's a Medicare approved charge, you're going to know it because Medicare will pay at least a penny to it. So if Medicare doesn't pay at least a penny or any kind of money to a charge, then the Medicare supplement is not going to pay anything toward that either. So that is the golden rule you want to keep in mind. If you see Medicare didn't pay anything toward a charge, then the supplement's not going to pay that either. And if you believe it was an approved Medicare charge that doesn't show up on your monthly summary report, then what you want to do is you want to question the coding of the people who wrote up the invoice. Okay. So that's something that I can help you with and happens a lot. And if you don't have an agent that's working with you or a broker who can help you facilitate that, then you're going to run into some challenges or problems. So keep that in mind. Okay. So anyway, with the Medicare supplement, you pay a monthly premium and you have to pay for your own dental, your own vision, and you have to pay for your own prescription drugs. So when it comes to prescription drugs, a lot of plans, if you're on Tylenol, you don't take anything but aspirin, but you want to avoid the penalty, the Part D penalty. You can get into a plan with a zero premium that you can get into that isn't going to affect you, but it's going to satisfy the fact that you're in Medicare prescription drug plan. And you can do that yourself. You can look that plan up yourself. So I created a YouTube video, right, on mywiseinsuranceguy.com. Again, that link's going to be at the bottom of this video. Okay. Click on that. It'll take you to my YouTube page. It's mywiseinsuranceguy.com. Scroll down, find the video that says prescription drugs or how to look up prescription drugs. And that's me giving you a short tutorial about how to do that. And if you have any questions beyond that, just give me a call, reach out to me. All my information is below when you hit see more below this video. If you haven't liked and subscribed yet to this video or this page, please do so, because as I update videos in the future, if you subscribe, you're going to be notified, right? And likes brings more attention to this page. And that's why I'm in this business, to educate folks, okay? And I love it. So anyway, when we're talking about supplements, so F plan is the best plan. If you turn 65 past 2020, the only options you have really are the G plan, which is the best plan that's out there today, or the N plan. So I like both of these plans. The N plan monthly premium is going to be a lot lower. And the big difference between the G plan and the N plan, well, let's talk about the G plan over the F plan. F plan covered everything. G plan covers everything but that Part B deductible, right? So that Part B annual deductible is $257. It's the only thing that G plan does not cover. So once you pay that $257, then you go into a full-blown G plan. And if it's a Medicare approved charge, you really shouldn't be paying anything outside of your monthly premium because the plan should cover it, except for that Part B deductible. The other big thing to keep in mind is this right here, excess doctor's charges. Doctors who don't actually take Medicare assignment can charge up to 15% beyond an actual Medicare charge, okay? So if you have a G plan and you're like, say, in surgery and you get a doctor in there that doesn't take Medicare assignment and he wants to charge you 115% of what Medicare, okay, is going to charge, then the plan's going to pay it, okay? If you don't have a plan that pays this, you're going to end up paying that. You're going to end up billed for that. Okay. So the plan is good for this, or just make sure that you don't have any doctors that don't take Medicare and you won't have to worry about that. So if you go to the Plan N actually is almost like the Plan G, except for it doesn't cover the Part B deductible and doesn't have the excess doctor's charges covered. Okay. So how do you get around that? Just be certain to say you don't want any doctor that doesn't take Medicare working on you, and you'll have a lot lower premium. You'll cut that premium from the G plan almost by 35%, sometimes 50%. So the other alternative is if you want to supplement because you see the advantage of a supplement, but you don't want to have a heavy duty premium, you can go with a high G or a high F plan. Okay. So we're really only talking about three supplements here, right? The high G and the high F allow you to have Medicare, which, like if Medicare Part B, doctors and specialists, you go to a doctor, he charges you $100. Medicare is going to pay 80, you're going to pay 20, right? That $20 is going to go toward that copay until you reach the $2,870 threshold. Once you reach that, then it turns into a full-blown G, right? Where you have to pay your Medicare Part B deductible, and then everything else is covered. But your monthly premium is going to be in the range of below 60, south of $60 a month. So very affordable, but it gives you access to all the doctors that take Medicare. You're not out of network anywhere. And you could take advantage of things like free gym memberships from Crunch Fitness, Planet Fitness. All these guys charge 10, $20 a month. So it's not really a big deal. And I offer dental on my webpage. So if you need to add dental vision, you can add it on my webpage. But that's the big difference between supplements and advantage plans. So hopefully I explained that well enough to you that you understand that. If you have questions, then go to my webpage. There's a link there where you can schedule a consultation with me, or you can call me if you can get a hold of me if I'm not busy. Then I will explain it to you or go over any questions that you might have. Okay. All right, let's move to the next slide. All right, so I want to shrink this window. Sorry, guys, just a little bit. All right, so it's not in the way. So Medicare Part A, let's talk about that. This is talking about skilled nursing care. Remember in the beginning of the video, I mentioned to you what Medicare does not cover. They don't cover long-term care, and they only cover a portion of skilled nursing care, okay? So that does include rehab, okay? So if you've got skilled nursing care and they're coming to your house, then it falls into this particular category. So when it comes to skilled nursing care, traditionally, because during COVID they changed this rule, you have to be in a hospital for 3 days and you have to get a referral from a doctor. Okay. Again, I said they waived that during COVID. That's not always the case, and may not be the case in the future. But that is the standard rule. So for you to get skilled nursing care, you have to qualify for it. Then once you do qualify for it, you need to be mindful that it is not covered 100%. So you covered 100% from days 1 to 20. That's not a lot. That's zero that you have to pay, right, for each benefit period. Then after that, if you go beyond that, 21 to 100 days, you're paying $209.50 per day in 2025. And then after 100 days, you pay all the costs. Remember, if Medicare doesn't pay one penny toward the cost of something, your Medicare supplement's not going to pay it either. But this speaks also, guys, to the importance of why, if you don't have a long-term care plan, or if you don't have money in a 401k that you can roll into an annuity and use later for skilled nursing care or for a assisted living or whatever when you get to that age, there's annuities. I like indexed annuities because you can't lose any money. You're only going to be making money guaranteed against any kind of loss. And you can add a rider where if you need skilled nursing care or you need to be in assisted living or a nursing home, they can draw into that money without charging you any kind of penalties whatsoever. So it's something to think about, something that I can talk to you about, but something you certainly should consider if you're aging into Medicare. Okay. Next slide. Okay, guys. So here's the thing. So we talked about that just a little bit. Let me shrink this window again so we can see the rest of this. All right. And so that's pretty much the end of the video. But what I want to do is talk about, since you're here and you're either going to be on Medicare because you're going on disability, you have to be on disability 24 months before you go on to Medicare, or you're aging into Medicare. So if you're aging into Medicare, whether you're retiring at 65, 67, you more than likely have a 401k. Okay. So you have to do something with that 401k, because once you retire, your company is not participating. They're not contributing funds to that 401k. And if the market drops, you're going to see a big loss and reduction in that money that you've saved up for all these years. So let me just share with you real quick the difference between mutual funds that you're going to find through a financial specialist or an index annuity that you're going to get from me. If you roll that money into an index annuity, it's guaranteed against loss. You're never going to lose. What an index annuity does is it goes against the stock market, right? And it pays you when they gain, but if you lose, it doesn't pay you. How do they get away with that? Well, they do what they call cost sharing, right? So it's like they may do, where you get 50% profit or a certain amount of profit over the 100% profit when there's a gain. So when there's a loss, you don't lose anything. So what people are afraid of is the penalties with an annuity. Everybody, financial planners and everybody like that, like to scare you with the penalties. But here's the bottom line. After the first year, after your funds have been in an annuity, after the first year, you can withdraw typically 10% of what's in there, right? So if you have $100,000 in an annuity, after the first year, you can withdraw 10% out without penalty. That's the general rule of thumb. You don't have to pay any penalty at all. So annuities are designed to be nest egg money. They're not really designed to be emergency money. I mean, it's sometimes a good idea because there's suitability issues. Nobody should be writing you an annuity if it's all the money that you have. Everything in your nest egg doesn't go in an annuity. They're not meant to be set up that way. They literally have a suitability clause where you actually fill out paperwork so they know that you're not putting your whole retirement into an annuity. You have to actually have funds for an emergency purpose that you can get to for emergencies, or you can roll some into mutual funds, but mix it up a bit. But if you want, what you want is you want your nest egg money to be protected, and you want it to be rock solid that you can get to it if you need to. But annuities are set up on either 3-year, 5-year, 7-year, or 10-year, where if you pull them out early, you have penalties for pulling them out earlier than that time, but you're taking advantage of a no loss product, right? Where you're gaining every single year against the market gains, not having to worry about the losses. So it's a really good product. The other things that you want to be concerned about is life insurance, okay? So if you don't have a life insurance policy, maybe you have enough money, you can self-fund, it doesn't matter. So, but if you are rich and you got a lot of money in the bank or mutual funds or in your annuities, probate can tie everything up. So the money may not be available to your loved ones when you pass. I highly recommend that you get a final expense plan or a life insurance plan. Final expense plans are really designed to pay for, the cost of a funeral. Up to $50,000. You go from 10 to 50,000, and those are going to pay for things like your funeral, airplane tickets, and enough for people to have a little bit of party while they're waiting for the rest of the stuff to get through probate. Okay, so that's a good idea. Final expense policies, when you get in them, they're whole life policies, so the premiums never change. So that's something we can talk about. Okay, the other thing to talk about is cancer plans. Okay, guys and ladies, the things that you're not aware of is that cancer affects 1 in 3 women and 1 in 2 men. Okay, so if you don't, it's probably one of the safest bets if you were to bet on a lottery. If you had those kind of odds with the lottery, you're going to be playing all the time. So cancer policies are not very expensive, and if you have a cancer policy and you develop a instance of cancer, and let's say you have a $50,000 policy, you can even get more than that at some points. They'll pay out immediately, no matter how many months. If you've only had it for 3 months, and then you develop cancer, they're going to pay out that benefit, and then that benefit is considered paid up, and you won't have that benefit anymore. But it will pay for things like if you got to go to the Cleveland Clinic or go to a different state because you come down with brain cancer, or you have something major where you got to get out of here and you want to take your loved one with you. a cancer policy is a good idea for something for you to think about to put into your portfolio. So, and I can help you with all of those things. Okay, guys. So anyway, that pretty much sums up our presentation, and I hope it helps all of you. If you have any questions, hit the see more button. All my contact information is there. You can give me a call or schedule an appointment. There's a 30-minute 30-minute free phone consultation that you can click on, schedule with me, and I will have that time dedicated to you. So with that being said, guys, hope this presentation helps you. Hope you have a great 2025 and hope you have an amazing day.